Hi, my name is Dr. Barry Cluner. I'm a practicing chiropractor in Kuala Lumpur, Malaysia, and I'm going to talk to you today about the concepts of posture, back problems, and ways to resolve postural stress. One of the most common problems that is presented to chiropractors and other physicians around the world is low back pain. In fact, about 4 out of 5 people around the world will experience low back pain at least once in their lifetime. That's 80% of our global population. Statistics indicate that around 30% of the existing population currently have a back problem right now. Unfortunately, children, teenagers are showing relatively increasing rates of back problems at younger ages before development has even been completed. Now, when we talk about our back, it's important to actually understand the proper design of the spine and then understand what it means to have postural stress. Our spine is designed in a very unique manner. We have evolved to be upright and straight. Looking at the spine from a front to back view, you'll see that the spine shows a very linear alignment, appearing quite neutral. Turning the spine to the side, it's not the case. In the neck area, with the eyes going forward, we experience a forward curve. In the mid-back area, we demonstrate a backward curve. In the low back area, we demonstrate another forward curve. And in the tailbone that everybody's sitting on, we experience another backward curve. It's important for these curvatures to remain neutral for as long as we possibly can to promote proper spinal health and allow our spinal cord and nervous system to work effectively. Well, we live in high-tech times, and in high-tech times we often sit more than we are active. And one of the complications that comes with that, is back stress. And if we can't control our posture, we start putting pressure onto portions of our back, which can lead to many problems. It can lead to muscle strains, ligament sprains, and if that isn't controlled properly, in fact not even diagnosed properly, then that problem can evolve into something more complex. More complex means it leads to wear and tear. A muscular problem leads to a musculoskeletal problem, which now involves more than just your muscles, but now involves your joint structures like your spine. Leaving it alone yet again, or having it improperly treated and supported, moves you into another category. As the problem evolves, it now becomes a neuromusculoskeletal condition, which is where now we involve not just the muscles, not just the skeletal structures like the spine, but now we're involving the potential of disc stress, nerve compression, spinal cord compression. Now, when going into the details of how the spine should remain proper in its positional alignment, we need to take a closer look at how the lower back is actually designed. Now, looking at it from the side, the lower spine retains a very important forward curve. It's called lordosis. Lordosis, forward curvature, is preserved based on the position of our pelvis when we are upright or when we are seated. One of the most common factors that leads to lower back problems from posture stress is when we end up having a condition called posterior pelvic tilt. What this refers to is the pelvis itself moving back posteriorly, which means it shifts and rotates back, which causes the lordosis to become a reduced lordosis. When the lower back loses that curvature, the upper back tends to fall very far forward, forcing the upper body to move ahead of the lower body. And this leads to a huge amount of postural stress upon the spine, the joints, and then again eventually becoming a complex problem. In terms of supporting the lower back, we have what we call core muscles. Now, many people think that the core muscle structures are just the abdominals. Well, they are. The abdominals is one sector, but the other components that support the lower back, the other core muscles are the muscles which are in between each of the spinal vertebrae on the front and back of the spine. The muscles that we also have at the lower portion of the pelvis floor. These are stabilizers. And again, when these are all working in unison, posterior pelvic tilt is minimized, which means proper curvature of the lower back is optimized. So by trying to support our spine, it's logical to try and promote back support by placing pressure into the lumbar region. And this makes sense, and it actually can be quite effective, providing you're willing to sit back against the lumbar support non-stop. But we know that doesn't happen. Most people tend to lean forward when they're using their computer devices, watching TV, eating, driving, video games, whatever it may be. This is an iPad era, and a lot of people are now facing very far forward. And again, when that happens, forward movement promotes backward pelvis tilt, which tends to flatten out the lower back and promote an unusual slouch. It's logical to understand then that the more common point to attack is not the back. Rather, as Mike has said, it's the bottom. By promoting some kind of modification from the bottom to lead the pelvis into a more anterior position towards what we call a neutral pelvis, you are then giving a guidance to start promoting normal lower back curvature. And when you can enhance normal lower back curvature, your upper body then falls above itself and can maintain that with much less stress, much less energy requirement, then leaving you with a greater potential for muscular stamina and, again, muscular endurance. Now, by design, BackJoy offers a very user-friendly and effective opportunity to help take away posterior pelvic tilt and promote more of a neutral pelvis. As you can see by the design of the backside of the support, when sitting on this in a snug position, it forces the pelvis to move into a more anterior position. This at the same time takes away the excess use of your muscles, allows you to sit without using extra energy, and allows the muscles to relax during your daytime. But at the same time, it also promotes the core muscles to start activating because the system is held in a neutral position. This in turn can actually offer a greater support to your overall core muscles even while you are sitting. So in the grand scheme, when you're sitting on a support like this, which can help to modify the design of the spine into neutral pelvis, you're eliminating a large majority of the risk factors that can cause back problems in the first place. Now, simply put, most back problems are actually preventable in the first place. Bad posture, being one of the most common reasons for lower back problems, is actually easily manageable. It's preventable. Preventing back problems in the first place just makes sense. Thank you.